Today we're talking about opposites affecting your body. Like many women, Ingrid wants to change her thin lips into a full, sexy pout.
I'm so sick of my thin lips. I've been envious of those girls with the fuller pouts for as long as I can remember. About 10 years ago, we're in college. My friends and I would be getting ready to go out and putting lipstick on, and it just became apparent to me. When I smile, my upper lip completely disappears. I wish my upper lip was a little bit plumper so I'd have a little bit more surface area to work with. When I look at the magazines, I see all these models with a full pouty lip and I get extreme lip envy. I hope that having the Maxi Lips procedure will boost my confidence, make me feel great, and I'll finally be able to rock that red lipstick that I've always wanted to rock.
Are women universally worried about the fullness of their lips?
Well, women want big lips. But I think you've seen it, Travis, that in certain cases, when you add stuff to the lips, you get that unnatural Donald Duck look.
Yeah, my first reaction when I see that is sympathy. Like, wow, I really wish you hadn't gone in for that procedure, because it's so obvious that you had work done that it's almost overwhelming.
And I couldn't agree with you more. So I came up with a procedure. I call it the Maxi Lips procedure. It's all natural. Why is it natural? Well, I use the patient's own fat that I treat with growth factors to make that fat last longer in the lips, but I combine it with internal cuts inside the lip to push the tissue forward. Therefore, you don't see any incisions, but you also are enhancing the volume of the lip by just moving your own tissue.
And since Ingrid was worried about her lips, we sent her to Dr. Orden's office for this exciting new procedure.
So what we're doing here today is a combination of surgical technique. We're replacing incisions inside the lips, and on top of that, adding volume to create those maxi lips. No incisions on the lower lip, but we're going to fill both the upper and lower lips. We use our special calipers to make sure these lines are the same length. We've created this little flap. It's a V-cut. What advances and plumps the lip is the way that we're going to sew it. We're going to place a couple more stitches, and we're going to release it, and you're going to see that advancement right away. Next step, we're going to harvest the fat from the tummy, but we go a step further. We purify that fat. The key is we're going to treat it with Ingrid's own growth factors. This is all our own tissue. It's her own fat. That's going to make the big difference. The entry port for the fat transfer is just done with a needle. The injection technique here involves tunneling and a little weaving. It's not just a squeeze of all the tissue in one spot. You want some in the border of the lip, but you also want some in the muscle of the lip. You're starting to see it right now. You're getting a good look at those maxi lips. Yeah, that's it. Well, I can't wait to show you Ingrid's new all-natural Maxi Lips.
I'm excited to see them.